body. Is it clear? There are different forms of vitamin D. We have the first form, which is at the level of the skin. It is cholecalciferol. Is it clear? So we are going to have cholecalciferol at the level of the skin. Is it clear? So that at the level of the skin, you need to know that in the production, cholesterol is going to be converted to cholecalciferol as a result of sunlight and the enzymatic processes of the skin. Is it clear? So we are going to have that, and this cholecalciferol is just containing one hydroxyl group. Is it clear? This cholecalciferol is also called hydroxy vitamin D. Is it clear? So it's also called hydroxycalciferol. So or hydroxy. So it's also called just calciferol. Is it clear? Now we have after that, after cholecalciferol, it is going to move now at the level of the. So this cholecalciferol is also called just vitamin D1. Is it clear? Now, this cholecalciferol move in the systemic circulation. It move in the systemic circulation is going to be acted upon by the liver. Is going to be acted upon by the liver to convert that cholecalciferol to so you are going to have hydroxylation of that cholecalciferol to produce what is called a 17 hydroxy cholecalciferol. Is it clear? Cholecalciferol, and this 17 hydroxy cholecalciferol is also called vitamin D2, and both of them are still the inactive form. Is it clear? Now the 17 hydroxy cholecalciferol moves at the level of the kidney. Is it clear? Now in the kidney, we have again another hydroxylation process. Another hydroxy group enters to produce what is called the 1725 it produces the 1725 dihydroxy cholecalciferol or just calciferol. Is it clear? And now this is called now vitamin D3. Is it clear? And this vitamin D3 is the active vitamin D form, and it is the one that is involved with reabsorption of calcium and phosphate at the level of the GI tract. It is involved with the calcification of bone. That is the release of the calcium and the phosphate from the blood into the bones. And this is the main vitamin D which is involved with rickets. In rickets, you are going to have low level of vitamin D3. Is it clear? There are certain forms of rickets where the patient is taking in vitamin D, but we have low level of vitamin D3 because of lack of the enzymatic processes occurring at each of these stages. Is it clear? So rickets is when there is a vitamin. Strictly the strict definition of rickets is when there is a deficiency of vitamin D3. Is it clear? Because vitamin D can be normal, you can have cholesterol, all that can be produced, but coming at the stage where there is conversion, there is enzymatic conversion or hydroxylation, you are going to have low level of vitamin D3. And this results to the disease when you have low level of vitamin D3, results to a disease called rickets. And rickets is in children. Is it clear? But in adults, we are going to have a disease called osteomalacia. After vitamin D deficiency, we have vitamin E. Is it clear? Vitamin E is also called tocopherol. Is it clear? And tocopherol is an antioxidant. Is it clear? Antioxidant. So if you don't take vitamin E sufficiently, you are going to have oxidatory processes occurring in the body, and oxidatory processes are most common risk factor for malignancy. So if you have a child with risk of malignancy, it's because of high oxidatory processes and low level of vitamin E. Now the next vitamin is vitamin K. Now you need to know that vitamin K is used in the formation of clotting factors. Is it clear? Vitamin K is used in the formation of clotting factors. Vitamin K in the formation of clotting factors. Now, the peculiar clotting factors that vitamin K is used in producing, it produces the clotting factor, the mnemonics is 1972. Is it clear? That is, those are the clotting factor that vitamin K is used in producing. So we start from back to up. So it's used in producing clotting factor 2, it's used in producing clotting factor 7, it is used in producing clotting factor 9, and also used in producing clotting factor 10. This one here is not 1 but instead 10. Those are the clotting factor that vitamin K is used in producing. And when you have low level of this clotting factor, you are going to have problem with coagulation. Is it clear? And if you have problem with coagulation, you are going to have bleeding disorders. Is it clear? But the bleeding disorders in cases of coagulation problem, it is a secondary, there's a secondary bleeding disorder, because with primary bleeding disorder associated with the thrombocytopenia, that one it occurs spontaneously, like in the case of scurvy where you have vitamin C deficiency. In scurvy, you just bleed spontaneously without any trauma, even mild trauma. But in the case of clotting factor disorder, you require some small trauma in order for you to bleed, is it clear, excessively. Example, these patients with vitamin K deficiency, if you just do some small puncture at the level of the skin before they have a peteke or they have a purpura, but on their self they're not going to have a peteke or purpura just like that. Is it clear? They need a minor trauma for them to have a peteke or purpura. Peteke, purpura, those are bleeding underneath the skin, or even ecchymosis. Then the next one, we are going to have also we are also have hemarthrosis, that's bleeding at the level of the joint. Is it clear? When they move there is mild trauma. Is it clear? So hemarthrosis, bleeding at the level of joint. So all these are disorders that you can have because of micronutrient deficiency, and it summarize the mechanisms of malnutrition. Now we are going to continue with the pathogenesis of malnutrition.